Have you ever wondered why healthcare costs in retirement remain one of the most overlooked expenses? It's a question that's been puzzling many of us for quite some time. Here we are, planning for our sunset years, dreaming of sandy beaches, grandkids, and leisurely afternoons. But the one thing that often slips through the cracks of our retirement planning is the potential cost of healthcare. It's easy to think that once we retire, we're done with the biggest expenses. The house is paid off, the kids have flown the nest, and we're free to enjoy our hard-earned rest. But lurking in the shadows of our retirement picture is an expense that can be as significant as it is unpredictable: healthcare costs. It's a topic that's complex, multifaceted, and let's face it, not particularly fun to think about, but it's also incredibly important. Because for all the planning we do for our golden years, the reality is that a large chunk of our retirement savings could end up going towards medical expenses. And that's a prospect that can really put a damper on those retirement dreams. So why is this topic so often overlooked? Well, it could be because we're an optimistic bunch. We like to think that we'll stay healthy and active well into our retirement. And while that's a wonderful goal to strive for, it's also essential to plan for the unexpected. After all, life has a way of throwing us curveballs, doesn't it? That's what we're here to talk about today. This video aims to shed light on the often overlooked aspect of retirement planning: healthcare costs. We'll delve into why these costs are a significant factor in retirement, why they tend to rise as we age, and most importantly, how we can plan for them. We're not here to scare you or paint a gloomy picture of retirement. Quite the contrary, we're here to arm you with information. Because knowledge, as they say, is power. And when it comes to planning for our golden years, every bit of power helps. So stick around if you're interested in learning how to navigate the maze of healthcare costs in your golden years. So, how much can you really expect to spend on healthcare once you retire? Well, let's delve into that. The reality is that healthcare costs in retirement can be quite substantial. On average, a couple retiring at age 65 can expect to spend about $275,000 on healthcare throughout their retirement. But remember, that's just an average. Your costs could be significantly more or less depending on a variety of factors. Let's break this down a bit. Healthcare costs in retirement can be divided into three main categories: insurance premiums, out-of-pocket costs, and long-term care. First, insurance premiums. These are the monthly costs you pay for your health insurance. For most retirees, this includes premiums for Medicare Part B, which covers doctor visits and outpatient care, and Part D, which covers prescription drugs. On average, you can expect to spend about $130 to $140 per month on these premiums. Next, out-of-pocket costs. These are the costs that your insurance doesn't cover, like co-pays, deductibles, and certain medications. It's hard to give an average for these costs because they can vary so much depending on your health. But, as a rule of thumb, the sicker you are, the higher these costs will be. Finally, long-term care. This includes services that help you with your daily activities like eating, bathing, and dressing when you can't do them yourself. These costs can be quite high, especially if you need care for a long period of time. On average, a private room in a nursing home can cost over $100,000 per year. Of course, these costs can vary greatly depending on various factors such as your age at retirement, your overall health condition, and where you live. For example, healthcare costs are generally higher in urban areas compared to rural ones. Clearly, healthcare in retirement isn't a one-size-fits-all scenario. It's a complex puzzle with many pieces. But knowing what to expect can help you prepare and ensure that you're not caught off guard by unexpected expenses. Ever wondered why healthcare costs tend to skyrocket after retirement? As we age, healthcare needs inevitably increase. This is an undeniable reality of life. But what you might not realize is that there are several key factors that cause healthcare costs to rise so dramatically in retirement. The first factor is longevity. Simply put, we're living longer. Advances in medical technology and healthcare mean that people are enjoying longer lives than ever before. But with increased longevity comes increased healthcare needs. The longer you live, the more likely you are to require medical attention. And as you might guess, these services don't come cheap. The second factor at play is inflation. Inflation is the rate at which the general level of prices for goods and services is rising, and subsequently, purchasing power is falling. As inflation rises, so do healthcare costs. This is because the cost of medical services, like many other things, tends to rise over time. So, if you're planning on retiring in 20 or 30 years, you can expect the cost of healthcare to be significantly higher than it is today. Finally, let's talk about the nature of the medical services needed in old age. As we grow older, we're more likely to require specialized and often costly medical care. This can range from treatments for chronic conditions to long-term care services, not to mention the cost of prescription medication. All these factors combined mean that healthcare in retirement can be a significant financial burden. So, why does this matter? Well, understanding why healthcare costs rise in retirement is crucial in planning for your future. When you have a grasp on these factors, you can better anticipate the expenses you might face and plan accordingly. Understanding these factors can help you better anticipate and plan for healthcare costs in retirement. It's not about fearing the future, but about being prepared and informed so you can enjoy your golden years without the worry of unexpected medical expenses. Now let's tackle the big question. How can you plan for these looming healthcare costs? First and foremost, start saving early. The earlier you start, the more time your money has to grow. Consider opening a health savings account, or HSA, if you're eligible. This account allows you to make pre-tax contributions that can be used for eligible medical expenses. And the best part? The unused funds roll over year after year, meaning you can build up a substantial nest egg for healthcare costs in retirement. Next, explore your health insurance options. Medicare is a lifesaver for many retirees, but it doesn't cover everything. You might need to budget for additional insurance, such as Medigap or Medicare Advantage, to help cover out-of-pocket costs. Also, don't forget about prescription drug coverage. These costs can add up quickly, so be sure to factor them into your plan. Long-term care is another important consideration. The fact is, many of us will need some form of long-term care as we age. This can be incredibly costly, and Medicare generally doesn't cover it. Long-term care insurance is one option to consider, but it can be pricey. Another strategy is to set aside savings specifically for this expense. It's not an easy conversation to have, but it's a necessary one. And don't forget to factor in the cost of inflation. Healthcare costs tend to rise faster than general inflation, so it's essential to factor this into your planning. There are tools and calculators available online that can help you estimate future healthcare costs based on current trends. Lastly, consider working with a financial advisor. They can help you create a comprehensive plan that considers all aspects of your retirement, including healthcare costs. Remember, it's not just about saving enough money. It's about managing that money effectively to ensure you can cover your medical expenses throughout your retirement. Remember, planning is key when it comes to managing healthcare costs in retirement. So, what have we learned about healthcare costs in retirement? Well, we've taken a journey into the sometimes uncharted territory of planning for medical expenses in our golden years. We've discovered that healthcare costs in retirement are often the unseen expense. They can be a significant part of your budget, and they're likely to rise as you grow older. We've peeled back the curtain on the reality of these costs. It's not a pretty picture, but it's one we need to face head-on. We've learned that as we age, our healthcare needs increase, and so do the associated expenses. This is a reality we cannot escape. We also delved into why healthcare costs rise in retirement. We learned that factors such as inflation, longer life expectancy, and the need for more medical services and medications all contribute to the escalation of these costs. But we didn't stop at just understanding the problem. We also explored how to plan for these costs in retirement. We learned that it's essential to incorporate healthcare costs into our retirement budget. We talked about various strategies, from investing in a health savings account to considering long-term care insurance. The key takeaway from our discussion is the importance of understanding and planning for healthcare costs in retirement. It's not something to be left to chance or to deal with when the time comes. It requires thoughtful consideration and proactive planning. And remember, it's never too early to start planning. The sooner you start, the more options you'll have and the better prepared you'll be. If you're feeling overwhelmed by all this, don't hesitate to seek professional advice. Financial advisors, insurance experts, and healthcare professionals can all provide valuable insights and guidance. Remember, the earlier you start planning for healthcare costs in retirement, the better prepared you'll be. So don't wait. Start today.